What should I expect for my IUD insertion? A lot of patients are nervous about getting an IUD inserted. Maybe they've heard from friends or on social media about how painful it is. So I'm going to talk to you a little bit about what to expect. The truth is, it can be pretty painful, but usually the pain just really lasts for really just those few seconds of the IUD going in. The experience is different for everyone. So some people really say, hey, that really wasn't so bad at all. Other people do have quite some pain, but mostly just during those few seconds of the IUD being inserted. Things that we can do to help with the pain, it can be helpful to take ibuprofen about half an hour before the IUD insertion. Another thing that we can offer is something called a paracervical block, which is like a lidocaine injection that we place around the cervix to decrease the pain of insertion. It is a little pinch and a burn with the lidocaine, but then it may decrease the actual cramping pain of the IUD going in. So that's something that you can talk with your provider about. There's a medication called Cytotec, misoprostol, that sometimes we'll give that can help soften the cervix and make the IUD insertion easier. Some people will do that routinely. Others will only do it if they expect that the cervix is going to be a little bit more closed, maybe if they've had a failed IUD insertion before, or if they haven't had vaginal delivery before. So these are all techniques that we can use to make IUD insertion easier. But typically, the entire process really just lasts a couple minutes. The provider will place a speculum. Sometimes we'll have to dilate the cervix a little bit, which can sometimes be a little bit crampy. And then placing the IUD itself really just takes a few seconds, and that's when there's that kind of strong uterine cramping just in response to the IUD going in. That usually, again, just lasts a few seconds, and then after that, somebody may have some cramping the rest of the day, a little bit kind of like period pain, possibly the next day, but the intense pain should not last beyond just that few seconds of the insertion itself. Most people tolerate it really, really well. We don't do sedation or anything like that. They can go home and go about their normal activities. Most people are feeling totally back to normal in a day or so. I hope this answers questions or fears that people may have about the process of IUD insertion.